In this video, we are going to discuss and talk about the prescription drug Desoxyn, aka methamphetamine. It is a stimulant and it can treat ADHD. It can also help obese patients lose weight. It is a controlled substance. It comes in one brand as Desoxyn. Availability, your prescription is going to be needed. In pregnancy, consult a doctor if you're pregnant. Alcohol, avoid. Very serious interactions can occur. What is Desoxyn and how is it used? Desoxyn is a prescription medicine used to treat the symptoms of attention deficit hyperactivity disorder, ADHD. Desoxyn may be used alone or with other medication. Desoxyn belongs to a class of drugs called CNS stimulants and orexin stimulants. It's not known if Desoxyn is safe and effective in children younger than 6 years of age. What are the possible side effects of Desoxyn? Desoxyn may cause serious side effects including chest pain, trouble breathing, lightheadedness, hallucinations, new behavior problems, aggression, hostility, paranoia, numbness, pain, cold feeling, unexplained wounds, skin color changes, pale red or blue appearance in your fingers and toes, convulsions, seizures, muscle twitches, aka tics, changes in your vision, fast heart rate, loss of coordination, nausea, vomiting, and diarrhea. Also sweating and shivering. The most common side effects, though, of Desoxyn are as follows: headache, dizziness, fast heartbeats, sleep problems, aka insomnia, diarrhea, and constipation. Upset stomach, tremors, loss of appetite, and weight loss. Tell the doctor if you have any side effect that bothers you or it does not go away. Warning: methamphetamine has a high potential for abuse. It should thus be tried only in weight reduction programs for patients in whom alternative therapy has been ineffective. Administration of methamphetamine for prolonged periods of time and obesity may lead to drug dependence and must be avoided. Attention should be paid to the possibility of subjects obtaining methamphetamine for non-therapeutic use or distribution to others, and the drug should be prescribed or dispensed sparingly. Misuse of methamphetamine may cause sudden death and serious cardiovascular adverse events. Desoxyn is also known as methamphetamine hydrochloride tablets. Desoxyn tablets contain 5 milligrams of methamphetamine hydrochloride for oral administration. Inactive ingredients are cornstarch, lactose, sodium, paraminobenzoate, stearic acid, and talc. Attention deficit disorder with hyperactivity. Desoxyn tablets are indicated as an integral part of the total treatment program, which typically includes other remedial measures, psychological, educational, social, for stabilizing effect in child over time, 6 years of age with the behavioral syndrome characterized by the following group of developmentally inappropriate symptoms: moderate to severe distractibility, short attention span, hyperactivity, emotional ability, and impulsivity. The diagnosis of this syndrome should not be made with finally when these symptoms are only of comparatively recent origin. Non-localizing soft neurological signs, learning disability, and abnormal EEG may or may not be present, and a diagnosis of central nervous system dysfunction may or may not be warranted. Exogenous obesity. As a short-term, aka a few weeks on this medication, adjunct in a regime of work with weight reduction based on caloric restriction. For patients in whom obesity is refractory to alternative therapy, repeated diets, group programs, and other drugs, etc. The dosage of Desoxyn tablets are given orally. Methamphetamine should be administered at the lowest effective dose, and doses should be individually adjusted. Late evening medication should be avoided because of the resulting insomnia. Attention deficit disorder with hyperactivity. For treatment of children 6 years or older with behavioral syndrome characterized by moderate to severe distractibility, short attention span, hyperactivity, emotional liability, and impulsivity, an initial dose of 5 milligrams of Desoxyn once or twice a day is recommended. Daily dosage may be raised in increments of 5 milligrams at weekly intervals until an optimum clinical response is achieved. The usual effective dose is 20 to 25 milligrams daily. The total daily dose may be given in 2 divided doses daily. Where possible, drug administration should be interrupted occasionally to determine if there is a reoccurrence of behavioral symptoms sufficient to require continued therapy. For obesity, one 5 milligram tablet should be taken 1/2 hour before each meal. Treatment should not exceed a few weeks of duration. Methamphetamine is not recommended for use as an anoretic agent in children under the 12 years of age. How it's supplied. Desoxyn methamphetamine hydrochloride tablets USP is supplied as white tablets imprinted with the letters OV on one side and the number 12 on the opposite side, and they contain 5 milligrams of methamphetamine hydrochloride in bottles of 100. There are some drug interactions, such as with insulin, also with some antidepressants. Drug abuse and dependence. Controlled substance Desoxyn tablets are subject to control under DEA Schedule 2. Abuse. Methamphetamine has been extensively abused. Tolerance, extreme psychological dependence, and severe social disability have occurred. There are reports of patients who have increased the dosage to many times what recommended. Abrupt cessation following prolonged high dosage administration results in extreme fatigue and mental depression. Changes are also noted on the sleep EEG. Manifestations of chronic on the sleep EEG. Intoxication with methamphetamine includes severe dermatosis, marked insomnia, irritability, hyperactivity, and personality changes. The most severe manifestation of chronic intoxication is psychosis, often clinically indistinguishable from schizophrenia. Abuse and or misuse of methamphetamine have resulted in death. Fatal cardiorespiratory arrest has been reported in the context of abuse and or misuse of methamphetamine. Warnings. Tolerance to the anoretic effect usually develops within a few weeks. When this occurs, the recommended dose should not be exceeded in an attempt to increase the effect. Rather, the drug should be discontinued. Difficulties with accommodation and blurring of vision have been reported with stimulant treatment, such as Desoxyn. Precautions. General. Desoxyn tablets should be used with caution in patients with even mild hypertension. Methamphetamine should not be used to combat fatigue or to replace rest in normal persons. Prescribing and dispensing of methamphetamine should be limited to the smallest amount that is feasible at one time in order to minimize the possibility of overdose. So all in all, what is Desoxyn? Desoxyn is a central nervous system stimulant prescription medication. It is used for the treatment of attention deficit hyperactivity disorder, ADHD. Desoxyn may help increase attention and decrease impulsiveness and hyperactivity in patients with ADHD. Desoxyn should be used as a part of a total treatment program for ADHD that may include counseling or other therapies. And as I said before, all in all, thanks for watching, guys. Here's some pictures of Desoxyn for y'all. And make sure you guys stay tuned for more to come. Drop a like down below. Drop a comment if you please. I appreciate you guys. Make sure you smash that subscribe button. And as always, cheers, ciao. Until next time. Peace, guys.